NCLEX review on sepsis in 2 minutes. Let's get into it. So sepsis is an exaggerated immune response to the infection. This could be bacterial, viral, or fungal in nature. And basically what you want to remember is that it's systemic or widespread inflammation everywhere. So because we have inflammation everywhere, this can lead to organ dysfunction, septic shock, and even death. So since we're not getting enough O2 nutrients, that's where the dysfunction comes in. The goals for us in sepsis is to identify and treat the infection. We want to maintain hemodynamic stability because if we're not getting enough blood or oxygen to our organs, we're going to eventually have organ damage. The signs of sepsis are, think of a systemic inflammation, fever, tachycardia, tachypnea. We can see hypotension if our patient's going into shock and we have a systolic blood pressure less than 90, or if we have less than 30 milligrams of mercury, less than our baseline. Altered mental status, hypothermia, decreased oxygen saturation, decreased bowel sounds, and decreased urine output or oliguria. And these are also signs of your organ dysfunction, so everything kind of starts shutting down. What are our labs that we want to look at? We might see an elevated white count, or you might see a decreased white count, especially if your patient has a suppressed immune system, has HIV, AIDS, leukemia, or is on immunosuppressant medication. The other labs you want to look out for is your elevated lactic acid, elevated erythrocyte sedimentation rate, and elevated CRP. Our platelets might be decreased, so our patient is definitely going to be more prone to bleeding. We might see an elevated glucose level, elevated creatinine, and elevated bilirubin. So what are our risk factors for sepsis? It's going to be a suppressed immune system, like I said previously, extreme age, procured organ, or a patient who's recently had an organ transplant, especially because they're going to be taking immunosuppressant medications. Any surgical procedure, indwelling devices like your Foleys, your central lines, and just sickness in general, like we talked about when it comes to infection. It can also be a nosocomial infection that the patient got in the hospital, like pneumonia. Bacteremia is another common cause, your chronic disease like CHF and COPD. The complications of sepsis are septic shock, right? So we might see hypotension, so we're going to have decreased cardiac output. The patient might be unresponsive to fluid resuscitation, which just means we're trying to give this patient IV fluids to bump that blood pressure up, but it's just not budging. So preventions, we're going to do proton pump inhibitors like pantoprazole or omeprazole, and DVT prophylaxis, glycemic control, and your treatment is going to be treating that infection. So your patient might be put on a broad spectrum IV antibiotic, IV fluids, and vasopressors like norepinephrine, neosynephrine, or vasopressin, etc. Your infection prevention would be vaccination, especially for your patients that are older. So you want to vaccinate them against pneumonia and influenza. And let me know what you want to see next in the comments.